For the radial head diagnosis, patient will be sitting and doctors will be standing. Doctors grasp patient's distal forearm without crossing the wrist joint. With your palpating hand, find and palpate the radial head. Patient's elbow should be flexed and relaxed. Let's start with static motion testing. Doctors, using your palpating hand and fingers, grasp the radial head and gently motion test anteriorly and posteriorly. Try to determine for yourself if the radial head prefers anterior position or posterior position. Here is a different view of anterior static motion testing and posterior static motion testing. To determine the radial head preference with static exam, move your patient's forearm into supination and pronation. See if you can determine if the radial head prefers the anterior position with the assistance of supination or posterior position with the assistance of pronation. Somatic dysfunction is always named for position of ease or motion of ease. So for example, anterior radial head should have a radial head preference on motion testing towards the anterior position. This anterior preference is also assisted by supination.